Hello, welcome to Wondermous, a leadership healthcare journey podcast. My name is Merikay Hunt, founder of Coach MK Companies, and I love meeting leaders in healthcare that are catalysts for positive and purposeful change. And that's what our firm does is we help leaders and their teams go to the next level in performance. Today, I'm super excited to welcome David Levine, and he is going to share a little bit about what inspired him to get into healthcare. David, share with our audience what that defining moment inspired you to get into healthcare.
Sure. No, thanks for having me on. I'm happy to be here, Mary Kay. So, it's kind of an interesting history when you go back and you look, what got you involved in medicine and how did you decide to do that? So for me, at a very early age, I decided that I wanted to go into medicine, and it was a personal experience. My mom was sick at the time. I was in kindergarten, and she had needed to have surgery. She was having back surgery for scoliosis. And I still remember to this day, I was there in the waiting room at the hospital, and my dad and I were playing that flick football where you fold a little piece of paper up to a triangle and you're playing at the table. We did that for hours while she was in the OR. And I can still remember seeing the surgeon walk down the hall as he's coming around the corner, and I saw blood all over his scrubs. And as weird as that sounds, that right there, I became fascinated with medicine and just thought that was the coolest thing of the way he came out and talked to us and explained what happened in the surgery and all that. I was really just totally fascinated by that whole process. And that was kind of the unique piece that then got me interested in medicine. And I had my whole childhood originally thinking, you go through the normal things. You want to be an astronaut, you want to be a marine biologist, you want to do those kinds of things, but medicine never left me.
Wow.
And that was something as I went through and had the opportunity in college to become a paramedic, got involved in kind of seeing the practice of emergency medicine, and that was kind of where I triggered into becoming an emergency medicine specialist.
And what a blessing that that incident didn't create fear, but it created sort of that catalyst. And you actually have that word in your profile on LinkedIn. So tell me what you feel like really helps you be a catalyst for healthcare and for leadership.
As you go back and you sit and you think on your life, your career choices, the things that you've done, you kind of see how these little journeys kind of come into play, and they all start kind of fitting together. So you take in the point of what first got me interested in medicine, and that was what brought me to wanting to become a doctor and go through that whole process. And it's not an easy process to go through. My dad he worked for General Electric. He was in sales and office type work, and I told myself, I never wanted to kind of work behind a desk. I wanted something a little bit more hands-on, and that's what kind of led me to that. And had the opportunity when I was in residency, and this is just kind of a unique thing, as you see the physician that operated on my mom when I was a child,
Right.
he was now retired and giving a guest lecture for the program in residency. And it was such a unique thing to see that full circle, to see
Sure.
somebody who actually inspired you to go into something, and then have that opportunity to meet him. He was that whole story was part of my med school essay that I had to write. So I had the opportunity to share that with him and let him know. So I really, really enjoyed that opportunity. Originally, like I said, when I went into medicine, I had no intention of wanting to do a normal, what you described as administration, and kind of get into that and being more of the office type thing. And as I started practicing, I realized, you can have a big effect on more people, meaning more patients and bigger outcome if you get more involved. And that was where my background in emergency medicine led me to becoming an EMS medical director,
Right.
and did that for multiple agencies within the county that I was at. Also then kind of snowballed into realizing, okay, I actually do kind of enjoy this piece of the work. Became the assistant medical director at the site that I was working at, and also became the SWAT team medical director. So had a lot of, kind of just organically evolved into leadership. Like I said, I'd never intended on doing that. And you realize as you go through this, some people go into to whatever specialty they're doing, whether it's medicine or business, and they have certain people that they view as mentors. And I always I didn't realize this at the time, but a mentor can be positive or can be negative. And you can
Yes.
sometimes learn from somebody where you learn some stuff from a particular individual that, maybe there's some good qualities that you take away, but you also learn some things to say, this is how I don't want to be. And so my experience with that, we had the opportunity, the group that I was working in, we had the opportunity to kind of break away and form our own company, with 7 of us becoming partners in the group, and working just at one hospital. And you hear all these great things of being a business owner and kind of managing your own thing. And so me being fairly young out of residency, it just seemed like a great thing. And I was all excited about doing it and really motivated to kind of excel. And we had put together a plan that was going to lead me. I was already the assistant medical director. And the plan was going to be, I was going to be the assistant medical director for 1 year and then move up into the facility medical director at that site. And that the person who is currently doing that would stay in that role for 1 year and then move up and just be functioning as CEO of our company. And, initially you're young and you're okay, nope, that sounds like a great plan. Let's go for it. A year goes by and, you start kind of hearing, well, we don't think you're quite ready. Let's give it another year. And young and naive, I sat there and said, okay, nope, that's fine. A couple of years go by and you start realizing this isn't budging. This isn't changing. Every time partners get together, we're not doing what our plan was. And so you fast forward a couple of years later, and after about 6 years of kind of going through this process of feeling like I'm actually putting in the work, doing the extra things, trying to earn that respect and earn that promotion, it never came. And I then had to make the decision, do I break away from what I'm currently doing and find something else so that I can feel I can grow professionally? And that was what I chose to do. And gave up my partnership, joined a larger organization in a leadership role, learned very quickly the differences between the mentorship that I was getting initially versus the mentorship under the larger organization. And significant difference in that. And so when I kind of commented that sometimes you learn some things that you don't want to do, what I took away from that point is, one, as a leader, part of your job and part of your role is to help people working with you and under you to grow professionally.
Right.
And if
Absolutely.
you don't help them do that, they're going to eventually leave and they're going to eventually become frustrated. So I felt as if I had almost been punished for years, and I was about 5, 6 years behind professionally
Wow.
where I would have been. And, hindsight, it was a great learning experience. It was a great thing I wouldn't have gone to the company that I'm currently with, and I wouldn't have been in the position that I am today if I hadn't learned that. And it's helped me professionally because it's one of the pieces that have stuck with me as a leader, is to make sure that I don't do the same thing to somebody else. And that even if it means having somebody leave and move to a different state and go work for a different organization, if it helps them professionally for what they want, I always think that's the best thing to do.
Absolutely. Well, and it reminds me, sometimes when I'm teaching my leadership class, I tell people, look, you have to believe in yourself first before other people can believe in you. And I love that that philosophy of say no to the good so you can say yes to the great. So you really, dug down deep inside your spirit, your mind, and your heart, and to put all that together to say, you know what, I'm ready to go to the next level. And I think that's one of the things that I really want to encourage people is, take an inventory of what you're doing in your work world and make a list. Write down all the things that bring you joy and are inspiring, and you feel fulfilled and you thrive. And then make a list of the things that are challenges and struggles. And if that list isn't an 80-20, 80 good, 20, bad, it may be an opportunity to make that change. So when a change agent was actually what was on your description, which is similar to me to being that catalyst. So tell me a little bit about your professional strengths and how you leverage them in your role that you do now.
It's always challenging, and I'm kind of, you feel like you don't always appreciate some of those things and some of the pieces that you bring to the table.
Right.
The times that I've actually changed roles and changed my position, or moved to a different company, and kind of changed what I'm doing, whether it was as a regional director managing different emergency departments or chief medical officer at a hospital, sometimes it's not until you leave the organization that you start to get that appreciation for what you've done and the change that you've brought to it, because it happens slowly and you don't necessarily see it until somebody kind of says, hey, look, these are the things that we're going to miss about you. um, and I think that the qualities I try to be is to try and, the way I was raised and the way I grew up was always, kind of follow the golden rule, and to do unto others as you want done to you. And I try and bring that into the workspace too, realizing that, you can't always, sometimes you have to message bad things. Sometimes you're not giving into what somebody wants. Sometimes, when you're managing physicians, and physicians can be very challenging, they're a unique breed of people to work with. um, to try and keep that integrity and that honesty, to make sure that you're, even if you can't do something,
Right.
you can explain the why, and try and feel like that people are not, are not, that we're not trying to take advantage of them, I guess is the best way to kind of describe that. Um, and I think where I've excelled in has been, I always describe, even no matter what was, when you go back and you look at different people going through med school. There were the students going through there that were the book smart, that could sit there and memorize what page something was on, and they could, verbatim tell you what that paragraph said, and they aced every single test. Then there's the other type of clinician that goes and learns by hands-on, and the
Yes.
actual doing, and that kind of process of doing that. And that's more where I kind of align, and it's how I try and lead, is by, more of the servant leadership and leading by example, and trying to kind of drive change that way. I don't expect things to happen overnight. I mean, there's been very few instances in my career where I've said, this was something that has to, maybe it was for a patient safety issue or something that you had to flip that switch quickly. But most of the time I find that things, and it's a fine line, because it's very easy to also allow something to take 12 months when it doesn't need to take 12 months. It may not be able to happen overnight, but you got to find that fine line of not allowing something to take too long as well.
Well, and I know originally you said that you weren't interested in the admin piece of healthcare, but I think what strikes me about you is your genuineness, your transparency, and your communication skills. Because sometimes the most intellectual people oftentimes don't have excellent communication skills. So I think that's been another point of leverage that you have as you're influencing people, and also the human factor piece of really seeking to understand, right? Because if we're trying to drive change and we're trying to make great things happen, we want people to follow and to do what we say. So when you think of kind of challenges that you're experiencing now in the healthcare realm, share some of those challenges from your perspective.
As a big picture, one of the biggest challenges right now is just the supply and demand of workers within the industry, and that's not just physicians. That's from everywhere from nursing, EVS, and housekeeping, and dietary, and every step along the way. EMS, your nursing homes, your other referral facilities. Everybody is in this part right now where they have, kind of this shortage. And what's, from a leadership standpoint, what's challenging is you can't just produce people. You can't. These are people that they have to have their unique set of skills. They have to have their appropriate training. It's not like you can just go and, hire somebody and say, I'm going to make you a doctor, I'm going to make you a nurse, I'm going to make you a NP or a PA. Everybody has to go through their training, so you've got a very finite pool of people to work with. You kind of overlay with that is, now because of shortages, you're asking people to do more with less, and that's a challenge to try. And I can sit there and talk to everybody, explain, hey, you're not the only one that's got this problem. All the other hospitals across the country are doing the same thing. And I think that helps them. There is kind of that sense that, misery loves company.
Right.
But what you have to is, you have to figure out, well, how do we pivot? Because some of these things are things that are going to change over the course of the year. Some of this is still some residual stuff, I think, of coming out of COVID and going through that lull of, we had such a decrease in number of people going into medicine during COVID that now we just, part of it is we're seeing the effect of that void of new people coming out, and that will eventually, probably rebound and stuff. But as a leader, how do you find new ways to make your teams more efficient and get better at what they're going to do? And that's where technology is huge right now. And there's so many opportunities within different technology that can help make our lives easier, but it comes at a cost, and technology is very expensive. And so that's a challenge, I think, for a lot of people within healthcare right now is, from a leadership standpoint, is how do you navigate new technology and making sure that it is implemented correctly, it's successful, it's going to be sustainable with whatever you do, but also you got to look at the bottom line and the dollar amount for it too. And that's where I see one of the biggest challenges right now facing us in the industry.
Right. Well, and last year I spoke at probably 7 different state medical manager group associations across the country. And when I asked, what's your biggest challenge? Everyone always responded staffing first. So even from a private practice standpoint, staffing. And then when we look at the hospital sector, the medical clinic sector, same thing. And just like you mentioned, taking the plane up higher and look at things from a different perspective, what I'd like to see is how we can modify administrative costs, right? And look at how we compensate our physicians, our nurses, everyone at a better level. Because when I hear of some of these astronomical salaries that some of the administrators are making, and then I see our poor nurses and our cafeteria workers and their minimal pay rates, that kind of breaks my heart. And so I think if we're really going to be strategic, we've got to look at how we are compensating people and the burnout rate. And it's also the constriction of decision making, because there's that philosophy burnout, then there's that philosophy of we're being handcuffed because of time and because of money and because of technology. And so talk to me a little bit about how we could restructure things. Let's just say in an ideal world, you had a magic wand and you could make it the best possible. What would you do?
That's such a loaded question, because there's so many different avenues that you can go down with that. And I think some of it's perception. I think of what people think. When we look at our society and where we're at and some of the challenges that we face, the kind of things I've always learned in this as I've gone through this, there's always going to be somebody getting paid more for doing less work than what you do. There's always going to be somebody who's getting paid less than you. As I've moved up into different ranks, there truly is a increase in responsibility and increased workload. And when I moved up into hospital administration, I mean, it truly is 24/7, 7 days a week, never stops, never had a day off, never. When I was doing that role, for 2.5 years, I didn't do any of the work around the house. I did not have time. And those are things I think that people don't always appreciate that. And it's hard to kind of look at that. So you want to make sure, if I could go back and just restructure everything, I think our healthcare in this country is by far phenomenal. It's our delivery process where we struggle with. And it's delivery, not only getting it to the community, but it's also an extremely complex process. Nobody understands the billing. Nobody understands how any of this is done, how the communication should happen. So I would first off strip away the processes that we've done from a billing standpoint, and you take into account that the billing is one arm, medical legal is another arm. There truly is defensive medicine being practiced, because you still have litigation out there that puts providers in a bad spot, that they feel they have to practice this way. You have so much we're talking about, then burnout. So much of what we do in medicine is just added regulations.
Right.
And there's many things that have happened over the years that, if you asked a subgroup of clinicians, there's always going to be different schools of thought. There's going to be one group that's going to say, oh no, this is a great idea, we should do that. There's another group that's going to say, no, we shouldn't.
Right.
And an example is narcotics.
Mm-hmm.
And, really when we look at what's happened in the country from narcotics, there was a period that physicians and hospitals were all measured and graded on how well they manage patients' pain. Anytime something comes out like that, and the regulating bodies, and when they come up with something new, I think that the intentions are always very good. They're trying to improve the quality of care, but
Sure.
any new measure that comes in, you now, as a physician, I have to change the way I practice. I have to change the way I document. You now, as an organization, you have different people being hired to monitor, to review charts, to
Right.
create metrics to grade people on. And then you feedback to providers saying, you didn't do this, you didn't do that. And so now they start feeling beat up constantly because I'm trying to provide good quality clinical care. I'm trying to document everything that has to be documented because every 6 months, the rules and regulations of what needs to be documented changes. And that kind of starts to snowball itself where people start feeling burned out because of that. And so when we look at what happened with the pain management component, there was a lot of providers that felt, this is not a good idea to make that. They essentially made it what they described as the fifth vital sign. And so heart rate, blood pressure, respiratory rate, temperature, and their pain score. And put regulations on, did you, for long bone fractures, did you treat the patient with IV or IM medication? And
Right.
if you gave them an oral pill, you didn't meet the criteria, even if
Mm.
the patient didn't need it. Sometimes people have a broken leg and tell you, I'm not in any pain. But if I didn't treat them, I didn't meet that measure. And
Wow.
so, despite the fact of writing my note of saying patient didn't want pain medicine, depending on who abstracts that data, some of
Right.
them will count that and say, oh, no, you were fine. Others come back and say, oh, you didn't meet the metric.
Wow.
And those are things where I think that and they offer very minimal benefit to the patient. And so, like I said, this was a huge rabbit hole I could go down forever on. So that would be one piece. The regulations, the monitoring, I would restructure that. I think there's a better way to do it. I'm not saying that it's not appropriate and doesn't need to be there, but
Right.
our processes need to be better. Um, the patient experience scores are very challenging, and providers feel beat up around that. The documentation piece is another issue, and some of that technology is starting to help that, and make offload some of that work. But
Mm-hmm.
again, it's expensive, and when you
Right.
have a lot of hospitals, and most hospitals in the country are not the big mammoths that are making huge dollars. You have a very, very small number of those facilities and organizations across the country. Your vast majority of small rural community hospitals, honestly, are struggling to just pay the bills and be able to do that and provide that service and then be able to buy that next new, MRI machine or CAT scan that's getting ready to break because everything has a shelf life and they have to replace that. Those are just a handful of things, but like I said, I could go on for hours about how to revamp healthcare and kind of change it and try and prevent burnout.
Well, one
I
thing
always,
that
I
I
always tell you,
one thing that I have
go ahead.
peace in my heart about you, David, is that you are going to be a champion for change. I can just sense it. And if you were going to tell your younger self some words of wisdom, what would you say to your younger self?
I think the biggest thing looking back that I wish I don't know if I would say regret but would go back and kind of change. Um, I spent over the years, I did not do, being that I originally did not want to go into leadership and administration, I didn't take any coursework. Everything I've done has been just more on the job training. And I feel that has probably served me better of
Mm,
trying to learn and try and understand people and develop my own personal management skill and style that I want to do. But where I feel I've made mistakes across the time was I was sometimes too cautious and too willing, and like that willingness to be able to take that leap of faith and leave the group that I was with because I just felt, oh, I'm too young, I'm not ready for this, and I can't move forward. I wish I would have been more aggressive with making some of those changes because hindsight going back, most of the time they end up being the right choice. I just was a little bit cautious and did them a year or two later than when I, wanted to. I think that was a little bit of kind of my upbringing was, more of that kind of be a little bit more cautious, whether that's with investments or whatever you're doing, that it's, have that sense of security. So that's where I think it would be the biggest thing I would change. And then, I think it's also important too to make sure that the people that are important to you and the mentors that you've identified, communicate with them and be able
Right.
to let them know that the people that you value and the people that have that knowledge and that resource, because they're typically going to be of the same mindset. And if they know that you value the information that they're sharing with you and the processes that they've helped you grow professionally, if
Hmm.
they hear that, they will, you just tip the it's a tip of the iceberg with what the knowledge and stuff that some of these people may have. And if they
Sure.
know you're engaged with them, and you will open up the door of a tremendous amount of information and knowledge, that they'd be happy to share with you.
Well, and I love that because in the book Think and Grow Rich by Napoleon Hill, he talks about pick your crown counsel, your imaginary crown counsel, and these are people that you want to mentor you, or you envision that you're sitting in a boardroom and you're the chair of the council. And when we do that, we can rise ourselves up to that next level too, and that's just part of that mindset, and really having that passion and purpose, which you do have. I'm grateful that you invested time to be with us today, and I just wish you the best for the future.
Well, thank you so much. I really appreciate you talking with me.